everyone, my name is Isabel Faustino. I am part of the Girl Scout Troop 60066, and this is the fourth video of the Learn About You video series. And today we're going to be talking about gender bias and health disparities. The three health conditions that we will be focusing on today are strokes, heart disease, and breast cancer. The first condition that we'll be talking about are strokes. So to start off, what is a stroke? So there are two kinds of strokes, ischemic and hemorrhagic. Ischemic is when the blood to the brain is either blocked or reduced, and hemorrhagic is when there is bleeding in the brain. Some symptoms to look out for if someone is having a stroke can be represented by the abbreviation BFAST. Balance loss, eyesight changes, face drooping, arm weakness, speech difficulty, and then time to call 911. It is super important that you call 911 as fast as possible so that they can have the best chance of recovery. Recovery is a rehabilitation post-stroke and helps to improve the quality of life. Some stats are that strokes have been the leading cause of disability in the US. And since 2005, 1 in every 17 deaths have been caused by strokes. Men are more likely to have a stroke than women until the age of 85, which is when this rate flips, meaning that women are more likely to have a stroke than men. By the age of 89, women have a 50% higher mortality rate than men. Projected that by 2050, 60% of the stroke population will be women. Women have lower qualities of life, higher depression rates, and are more likely to require assistance post-stroke. Between the ages of 49 to 54, women have their first recurrent stroke within the first 5 years before men. The next condition that we'll be talking about is heart disease. Heart disease is the leading cause of death in both sexes, and the most common manifestation of heart disease are heart attacks, which is when blood flow to the heart is either reduced or blocked by plaque in the arteries. The average age that men will experience their first heart attack is 65, and the average age that women will experience their first heart attack is 72. Since 1984, more women have died from a heart attack than men. Women typically minimize their symptoms and wait longer before receiving treatment. One study showed that women waited 54 hours before treatment time in comparison to men who waited 16 hours on average. Regardless of age, women have a lower survival rate. After having their first heart attack, women are more likely to develop a heart disease, suffer a stroke within the first 5 years, or die than men. The final condition that we'll be talking about in this video is breast cancer. Breast cancer is rapid and irregular cell growth, typically in the ducts or lobules of the breast. The most common types of breast cancer are invasive breast cancer, ductal carcinoma, and triple-negative breast cancer. Breast cancer is one of the most common forms of cancer among American women, and in every ethnic group, breast cancer is the most common form of cancer. No matter their age, Black women are more likely to die from breast cancer, and 1 in every 10 women has breast cancer. Triple-negative and inflammatory breast cancer disproportionately affects Black women. Some risk factors are having a familial history of breast cancer, previous radiation treatments, specifically in the breasts, prolonged exposure to progesterone or estrogen, and your age. Some ways to decrease your risk of having breast cancer is by maintaining your physical health, breastfeeding, or having multiple pregnancies at an early age, because that has the possibility of decreasing the amount of menstrual cycles that you will have. Breast MRIs use dedicated breast coils to determine the exact position of a tumor. Breast MRIs may be better suited for Black women because on average, Black women have higher density breast tissue. Because of the higher density breast tissue, this means that mammograms aren't the most effective tool for them. After analyzing 5,000 Black women, this study found that women living below the poverty line and women who did not regularly attend their scannings were more likely to have a diagnosis in later stages of breast cancer. Just to recap, strokes are the leading cause of disability in the US, and men are more likely to experience a stroke than women until the age of 85, which is when this flips, and women become more likely to experience a stroke than men. It is also important to be fast to recognize the symptoms right away and call 911 as soon as possible. In regards to heart attacks, more women have died, typically wait longer for treatment, and have a lower survival rate. Breast cancer is the most common form of cancer. Your risks of getting breast cancer increases after the age of 55, and it is important to always stay active. And lastly, look out for you. You should always be your best advocate. Thank you for watching this video, and I hope you learned a little something.